Hey guys, Dr. Childs here. Today we're going to be talking about the cleanest thyroid medications on the market. If you are a thyroid patient that has been using your thyroid medication faithfully and you're still experiencing symptoms like weight gain and hair loss and constipation and cold intolerance, etc., in other words, that medication doesn't appear to be working for you, one potential explanation for this may be the inactive ingredients. The active ingredients are generally very similar among all thyroid medications except for the difference between T4, T3, and sometimes T2. Where these medications differ dramatically is in their inactive ingredients. And believe it or not, these inactive ingredients have the potential to impact how well that medication works for you as a thyroid patient. Before we jump into the cleanest thyroid medications by class, we're going to be talking about T4 only thyroid medications, T3 thyroid medications, and NDT thyroid medications, and I will give you a clear winner in each category. I want to first talk about some basics here. The first thing that you need to know is that every thyroid medication contains both active ingredients and inactive ingredients. When it comes to the active ingredients, every thyroid medication contains bioidentical thyroid hormones. All right, that means that the thyroid hormones found in your medication are the exact same as the thyroid hormone that your thyroid gland would be producing if it were in the healthy natural state. There's no structural difference between these two things. That means the same T4 that is found in levothyroxine is the same T4 that is found in Armour thyroid or any other NDT thyroid medication. Yes, the medications differ in terms of their other ingredients, but the T4 and the T4 are the same in each. And that also is true for T3. So the same T3 found in Cytomel is the same T3 found in NDT. The sourcing is different, but they look identical. The second thing you need to understand is that every thyroid medication contains inactive ingredients. And these inactive ingredients do a lot of various things. Sometimes they're there to improve the absorption of the medication. Sometimes they're there to just change the color of the medication. Sometimes they're there to just improve the manufacturing process. It doesn't really matter why they're there, just know that they are there. And these inactive ingredients have the potential to negatively impact how well that thyroid medication works for you as the thyroid patient. So what you can do as a thyroid patient is if one thyroid medication in some class isn't working for you, you can always try switching to another one even within the same class. Because even though the thyroid hormone content is the same, you will be getting different inactive ingredients. The second thing you need to know is that even though the information that I'm sharing with you right now is really important, if your thyroid medication is not working, I want you to first check on your dose and the type of thyroid hormone that you're taking. So for instance, let's say that levothyroxine isn't working for you. It's likely the case that one of the main reasons it's not working for you is not because of the inactive ingredients, but because your dose is too low. In other words, if you're not taking enough, it's not going to help you. And let's go back to this example of levothyroxine for a minute. Maybe you are taking the right amount of T4, but you also need some T3. That's what I'm talking about when I mention the type of thyroid hormone. So before you look at the inactive ingredients, make sure you take care of your dose and the type of thyroid hormone that you're taking, because your problems might be solved just doing that. Let's assume that you have done that, and let's talk about the winners in each class of thyroid medications based off of their inactive ingredient profile. So when it comes to T4, we have two winners here. I know I said I'd give you one. I lied. I'm going to give you two. So for T4, we have Tirosint and we have Tirosint-sol. Tirosint, of course, is the gel cap, which I'll write here, and Tirosint-sol is the solution. When it comes to inactive ingredients, Tirosint contains just glycerin, gelatin, and water, and Tirosint-sol contains just glycerol and water. So technically, Tirosint-sol would be the winner here, but Tirosint is a little bit cheaper, a little bit easier to get, and it has generic, so I'm including it here for that reason. I personally don't care if you use the name brand or not. I would say whatever insurance covers and whatever is the cheapest for you. I'm just telling you that these two have the least inactive ingredients compared to all other T4 only thyroid medications. There are countless stories of thyroid patients who have made the switch from levothyroxine to Tirosint or levothyroxine to Tirosint-sol, and that alone has made them feel a lot better. All right, let's move on to the cleanest thyroid medications in the T3 only thyroid medication class. So here we have another clear winner-ish, and that is sustained release T3. So sustained release T3 is different from the immediate release versions like Cytomel and levothyroxine because it stays in your intestinal tract a little bit longer. The only way to get sustained release T3 is by getting it compounded from a compounding pharmacy. This means you're going to have a doctor that is aware of compounding pharmacies and knows how to write a prescription for them. The good thing about compounding pharmacies is that they can alter and titrate your dose of thyroid medication to your specific needs. And in the case of sustained release T3, what they do generally is they take the T3 component and they bind it to something called methylcellulose. Methylcellulose is a very sticky substance which acts to latch onto that T3, which means it's harder for your body to absorb it, which means it delays the absorption, and we call that sustained release. Now, one big problem with this is that yes, it delays the absorption of T3, but sometimes it works a little bit too good. Even though it is technically the cleanest T3 only thyroid medication, some thyroid patients still do better on the dirtier T3 only thyroid medications like Cytomel and levothyroxine. This really just highlights the fact that there's a lot of nuance here and it's not always as straightforward as you might think. Cleaner isn't always better if it means you're not getting as much thyroid hormone as you would otherwise. All right, next let's move on to the NDT class of thyroid medications, which of course stands for natural desiccated thyroid. Roughly speaking, all of these thyroid medications, at least the ones that are currently available on the market, are all kind of similar. So if I had to pick a winner by a slim margin, I would say NP thyroid is going to take it. NP thyroid contains 4 inactive ingredients, including calcium stearate, dextrose monohydrate, maltodextrin, and mineral oil. I'm saying NP thyroid is winning it right now, but the reality is if WP thyroid was still on the market, it would probably be the winner because it has the fewest inactive ingredients out of all NDT medications. The reality is though that you can still do very well on Adthyza, Armour Thyroid, or NP thyroid if you're looking for an NDT thyroid medication because they're all roughly the same. So what's more important here is just playing around with these various types of medications until you figure out what works best for your body. The inactive ingredients found in the various types of thyroid medications can definitely impact how well that thyroid medication will work for you or won't work for you. But the big takeaway that I want to leave you with is that it's going to take some trial and error for you to figure out what works best for you. If you're interested in learning more about the breakdown of the most common thyroid medication, levothyroxine, I would check out this video next where I explain what each ingredient is doing and how it may negatively impact your body.